I don't work and I don't go in the office until 3 p.m. And that's when I see patients, because we're looking at treating people, of course, during later time frames. So we have morning appointments 3 days a week. We have afternoon appointments 5 days a week. And then we work 2 Saturdays a month that we're open by appointment only. So I got into chiropractic because I was back in Michigan, and when I went to college, I went to a college in northern Michigan, and it was an optometry, pharmaceutical school that specialized in those type of things. And my roommates were pharmacists, and they said, Mike, you study your butt off, why don't you go ahead and become a pharmacist? I said, you know what, I really don't want to push pills for the rest of my life. Their whole goal was to either go into medical school or open up a pharmacy, like a neighborhood pharmacy. Do those exist nowadays? No, they don't. So I had some good buddies back in Michigan. I grew up in an area around Detroit, not in Detroit, but around Detroit in Southfield. And we were the only Gentile family in all Jewish area, so I'm pretty good at, Hebrew and all that. And they always thought I was Jewish, so I said, yes, I am. But being 100% Italian, you look alike. So what happened was a good friend of mine was in chiropractic school, and I said, well, tell me more. Because I had an injury when I was a kid at 15 years of age that hurt my back. And at 15 years of age, I went to the Yellow Pages, looked up chiropractor, and had my parents take me to this chiropractor and went through the treatment protocol. He took x-rays on me, explained this stuff to me, a 15-year-old, but did not explain it to my parents, which was stupid, because the parents should understand this. When chiropractic is intervened, and chiropractic is only for those people that have spines. That's it. Just like dentistry is for people that have teeth. It's the same darn thing. A qualified chiropractor should be looking at the biomechanics like an engineer is going to build a building. That's what a qualified chiropractor is going to do. Unfortunately, some of the schools, and because of the insurance industry, they don't want doctors taking x-rays. Well, what the heck? I don't touch a patient without taking x-rays on them. Why? Because I don't know what the heck's going on in their body. I don't have see-through vision. I am not Superman. So I always take x-rays. I draw biomechanical lines on the spine to identify where you're at. Do you have a head-forward posture? Do you know with a head-forward posture, what's happening in the individual? Besides aging, they have all kinds of brain dysfunction. Because the brain will not go into a dysfunctional state if we have good posture. Posture is real critical. So we're looking at what we call side view. We're looking at an AP view. Do we just handle the people, older people? No, we handle kids. Because it is sad to say that if you have a child or a teenager that has a sports injury and you're taking them to the orthopedic surgeon, God forbid, and then the surgeon says, well, let's do surgery. This has happened with quite a few young patients of ours that were athletes that had the ability to go on to scholarships. And they said, oh yeah, let's just go ahead and do that, rotator cuff surgery, you're going to be fine. Let's do the knee surgery, you're going to be fine. You'll be back playing volleyball in 6 to 8 weeks. No, they were done. The body has the ability to heal itself. Do you believe that? When does it have a better time to heal itself? When you're young or when you're old?
Young.
When you're young, absolutely. What we find today is people do not heal as well as they used to heal. Why? Because everybody's screwed up. It's the truth. You're inflamed. You have so much inflammation because what you can tell by looking at someone, you look at their skin, you look at their hair, you look at their eyes, you look at their tongue. Stick out a person's tongue, if they have all kinds of cracks in their tongue, if they have a crease down the middle of their tongue, they're not digesting and they have a lot of inflammation going on. If they have imprints in their tongue, they have a lot of inflammation. If their eyes, if they had red streaks in their eyes, they're going through a lot of inflammatory processes. What is inflammation? You know what inflammation is? Swelling, obviously. But it is the aging process. It's the advanced aging process. So what do you hear about fallacies? I'm going to give you some fallacies to go over with, right? How many people have to get up at night to go to the bathroom? Because it's a normal aging process. No, it's not. It's a sign of inflammation going on in your body. You shouldn't have to do that. I am 59 years of age. No. I'm going to be 60. Yeah, I'm going to be 60 in February. I never have to get up to go to the bathroom. You shouldn't have to get up to go to the bathroom. That's just a fallacy you're led to believe by the pharmaceutical industry or, doctors, unfortunately. So, normal aches and pains, like it's a normal aches and pains because you're going through the aging process. No. Oh, you're going to develop arthritis. Arthritis is an inflammatory process. Yes, injuries will precipitate this. What's really interesting is our practice is involved in chronic patients. I saw a gal yesterday, a nurse. She's a surgical nurse. She's got a thyroid problem. She's got Hashimoto's, which is an autoimmune thyroid. The problem is she's developing other antibodies. You cannot have one autoimmune system going on or attacking your body without having other autoimmune attacks going on. What's Parkinson's? Autoimmune. What is dementia, Alzheimer's? Autoimmune. These are all autoimmune conditions, and the problem is you got to be able to address that. What we do in our office, I've stolen the best from medical doctors and other doctors around the country that are into what they call integrative. My brother and myself were at a seminar this past weekend with medical doctors and acupuncturists, the nutritionists, and all this other individuals learning from these different doctors. One was an MD, one was a chiropractor that had another 4 degrees. But the whole idea is to address people. She's got this situation. She's already exhausted the medical route with the Hashimoto's. What are they going to do? They can't really do anything. All they're going to do is put her on, God forbid, a corticosteroid. What does a corticosteroid like prednisone do? It turns your body into mush. It turns your body into mush. You start developing avascular necrosis. Next thing you know, you need a hip replacement, shoulder replacement. You got bone problems. You got osteopenia, osteoporosis. You just screwed up. But the drug industry, of course, are telling you, you know, better life through drugs. It's not true. I haven't taken a drug since 1979, not even an aspirin. Why? Because if you're living your life the proper way, if you're addressing those issues, if you're going through the preventative aspects, you should be healthy. It's kind of interesting. I was listening to this PhD, and I studied the blood work analysis, how to really interpret blood tests. I got a patient, she's got high cholesterol. She's put on statins. She doesn't want to be on it. So we're helping her overcome that. Got another patient that's a problem, she can't get pregnant. She's 30 years of age. So we're helping her address both the woman and the husband by getting them to have healthier kids. Let me tell you something. Anytime someone is having to go through artificial insemination or any other type of, you know, hormonal therapy to get pregnant, not a good idea. You know what the research is showing with these babies? They're not as healthy. Not as healthy. Get the body healthy. How many people prepare to have healthy kids? By preparing themselves to be healthy first, so that your DNA that you're passing on is going to be good quality DNA. Because that's what we call epigenetics. Anybody ever heard that terminology? You got 2 paths, right? You got the genetic predisposition of your line, you know, your genetic line, but then you got another path that you can take. Our whole purpose in our office is to direct you down that healthy path of epigenetics, getting you healthy. What do we test? We do a test called a meta-oxy test to determine your antioxidant level. What do we want? Do we want a high antioxidant level and low free radical?
Yes.
Absolutely, because free radicals we know is disease, cancer, and everything else. We also do what we call a visual contrast study, which is a visual test. The most sensitive nerve in your body is the optic nerve. Where's Dr. Tran? To toxins, a Dr. Shoemaker, you might look at that. Anyways, if you have what we call biotoxins, like molds or heavy metals or general toxicity, this is going to show up in this visual contrast test that we do. It's phenomenal how many people are so compromised. So on my cards at EdMake, which is a great job, you know, fantastic, you put my our YouTube, because what people are finding is by doing the internet searches. I mean, the thing, you know, people say, what do you treat this condition or that condition? I treat the body. And if you treat the body, it's going to heal. If you don't fix the body and start with the basics, it's not going to heal itself. Get rid of the interference. It's just like when this other PhD, he did a major study 25 years ago, and a neurologist did this study. They found post-whiplash injuries, the individuals have thyroid problems. I've noticed that. 3 things that you'll see that an individual is going to have as far as from a physical standpoint of indicating they have a thyroid is that they have a dowager's hump. They have a little hump here where the neck ends and their upper back begins. They have a thicker neck. And then they have dysfunction at the C5, C6 vertebra, either as degeneration, arthritic, or some displacement big time going on. So I had this gal that worked with us 25 years ago come in the office yesterday. She was one of our CA's chiropractic assistants back then. She went on to become a doctor of chiropractic, and now she's teaching at one of the schools up there. And so I was telling her all this. She says, why don't you do research? I said, I'm not a researcher. I am, you know, the type of person that helps people, treats them and all that. So hopefully we're going to start this whole thing. All righty. Time is gone. I try to talk fast.